Great. So welcome everybody to our session, Basics of Lymphedema Care. This is going to be presented by Carol Armstrong. Before we jump into her presentation, there's just a couple slides that I wanted to go through. So the first one is just a little bit more about the BCLA. As some of you probably know, we are celebrating our 15-year anniversary as the provincial resource to promote optimal healthy living with lymphedema. So we're really glad you're here to celebrate with us. And a little bit more about our goals. You can see them on the screen here, but really we want to advance awareness and knowledge about lymphedema. We want to advocate on behalf of people and families that are affected by lymphedema, encourage patients to take an active role in the management of their condition. We also liaise with the Canadian lymphedema community. And we really want to become known, respected, and promoted as a resource by our key stakeholder groups. And finally, we want to encourage and support local, national, and international lymphedema research and development. So that's just a little bit about the BCLA goals. And I've also put on here the additional events that we have going on for World Lymphedema Day. So if you're interested in any of these, they will all be available on our website. And now to introduce Carol Armstrong. Carol is a registered massage therapist based out of Victoria. She's certified in manual lymph drainage and combined decongestive therapy with the Dr. Votter School, and she did that in 1993. In 2004, she pursued training in measuring for medical compression as a way of providing best practice care to patients with lymphedema. And part of her training was in Italy and Germany with Angela Vollmer, probably is how you pronounce it, including the opportunity to observe in 3 institutes dedicated to lymphedema diagnosis, assessment, and treatment. Seeing patients treated holistically under one roof was really an inspiration and has remained a hope for her that one day this would be a reality for patients in BC. Carol, along with Denise Drisdell, offers ongoing monthly information sessions on lymphedema through Inspire Health. And with that, I'm going to stop my share. And Carol, it is over to you.
Great. Thanks, Charlotte. So here we go. Sorry, this. I didn't have it open at the right area and I can't get rid of the top. Oh, there we go. Oh, sorry. Start at the beginning here. Okay. So thank you for the opportunity, BCLA, to share this information with everybody. And I need to just move this over because it's in my way. So the objectives that I set for today were: what does a newly diagnosed patient with early stage lymphedema need to know? And why do we need to take care of lymphedema and how is it managed? And so what is lymphedema? Essentially, it's a swelling, also known as edema. The medical word is edema, and swelling of a body part that lasts for longer than 3 months, and the fluid is high in cellular waste and protein content. There are 2 types of lymphedema, but they're both managed in the same manner. A primary lymphedema is an inherited condition, so the body has perhaps not been born with a sufficient number, or the vessels have been malformed in some way. And the secondary lymphedema, the person is born with an intact system, but through some form of interruption, it is no longer able to fulfill its role in the body. Sometimes this happens as a result of infection or surgery or radiation treatment, or just an injury, a repeated injury. Currently, there is no known cure for lymphedema, and it is considered a chronic condition. So with secondary lymphedema, I wanted to quickly just highlight that there are areas that we consider at risk. The body is divided into 6 main draining territories. And so it's a bit like valleys that drain the surrounding mountains. And we have these dividing watershed lines left and right, and below the collarbone and above the waistline, and everything in the skin that would drain on the trunk, and the right-hand side arm and hand would drain into the lymph nodes in the right armpit. Everything below that line would drain from the toes up to the waist, front and back in the skin, would drain into the groin lymph nodes on the front here. Everything above that line, above the collarbone, would drain the head and neck region. So people are often concerned, well, which areas do I need to keep an eye on? And the example I've given here is if we had a left armpit excision or axillary node dissection or sentinel node biopsy, or there was radiation to that area, then the left side would be considered at risk for the left arm, the left hand, and the remaining breast tissue or the trunk on that side. For women or men who've had a prophylactic mastectomy where there is no damage to the lymph vessel or the lymph nodes rather, then that area, that side is generally not considered to be at risk. Typically in a primary presentation, initially the swelling begins at the furthest point down the limb and it progresses centrally toward the body. And if it's a secondary presentation, most commonly it starts at the top of the limb and it works further down the limb. Now this isn't always the case, but this is often what is reported. Onset can come on very suddenly or it can come on very gradually. And if it's not treated, it will tend to get worse if it is not managed. The symptoms that people experience will often come in cycles that flare up and settle down until eventually the body, reserve capacity of the lymphatic system is no longer able to remove that fluid and the swelling becomes a more permanent condition. And in very early cases, it is possible to mitigate the impact of that swelling so that we can reduce the changes in the tissues. But in most cases, it requires lifelong monitoring and care. Unfortunately, it has a huge health cost to the patient, physically, financially, and emotionally. And patients often have to advocate for themselves through the healthcare system. So what is our lymph system? If we think of the circulatory system as a closed loop system, so the heart pumps circulation out into the arteries, most of it's returned by the venous system. Some of that fluid that gets put out into the connective tissue has to be drained away by the lymphatic system. And our lymph system is a one-way system. It's not it doesn't have a loop system like the circulation. It starts in the skin and it passes along one-way vessels into deeper vessels, and then eventually it rejoins the venous system at the base of the neck. The vessels are very delicate, and each time the fluid passes through lymph nodes, it gets cleaned and filtered, much like a water treatment plant, so that eventually by the time it's returned to the venous system, it is safe for the body to either decide, does it need to keep that fluid to maintain overall fluid, body fluid balance, or does it need to excrete it and you go to the bathroom. As it is draining that fluid from the tissue, it removes the waste, the byproducts of the normal byproducts of metabolism, any kind of basic garbage that the body doesn't need. It's also part of our immune system, and it is responsible for transportation of medium and long chain fatty acids. So the lymphatics, these lymph vessels, they have to remove the larger protein molecules that are too big to fit back into the venous end of the capillary. And if we have a compromise in our lymph system, then those large protein molecules stay trapped in the tissues. And protein is like salt, it will bind with water and it creates sort of a gelatinous, sticky fluid. And I just want to mention that dietary protein is important. Obviously, it's a basic building block. It's not, we need to ingest protein. It's just how the body breaks it down and into its constituent parts. The small pieces can fit back into the venous system. The larger pieces have to be taken away by the lymphatics. So why do we need to take care of lymphedema? Well, if the main changes that we first see are in the skin, and if we think of it as normal skin thickness being analogous to kiwi, the changes that we see as lymphedema progresses makes that skin turn to be more like the skin of a grapefruit, so it's thickened. And there are also changes in the connective tissue, so there can be hardening fibrous tissue that gets deposited in that area of congested tissue swelling. And there is a progression of fatty deposition in those tissues as well. So all of these factors contribute to further compromise in the drainage, and many of them are irreversible. Lymphedema also carries an increased risk of infection, and either known as cellulitis or erysipelas, depending on which level of the skin is involved. And this causes more swelling and more scarring in those vessels. Patients will sometimes have episodes of flared swelling, and it can be hard to pinpoint exactly what it was. That often it may not be just one thing, it might be several factors that are contributing to more swelling or more compromise, and a gradually overwhelming of the lymphatic system so that the fluid stays trapped in the tissues. When it's managed early, it is possible to keep it in a stage 1 and not have it progress, or progress minimally so through secondary changes. But unfortunately, ignoring it and hoping that it will go away doesn't end up with a good outcome. So what happens when fluid stays trapped in the tissue? Well, if we never take the garbage out, or we don't have garbage collection, you can see that it creates for a lot of waste material accumulating in those tissues. It creates an opportunistic environment for bacteria to thrive. There's delayed nutrition to the cells, there's delayed wound healing. There are lots of consequences to not having good fluid exchange in those tissues. So people ask, well, why can't you just stick a needle in it and withdraw that fluid out? If a person has had a mastectomy or some other kind of surgery, there might be a seroma, which is a pocket of fluid underneath the surgical site, and the surgeon can insert a needle and draw that fluid off. So the fluid with lymphedema is not in a contained sac. It is part of our connective tissue. And so it's kind of like within the architecture of the connective tissue. So it's like a sponge in our body. We can't just put a needle in and draw that fluid off. One of the questions that I got was, what does stage 0 mean in lymphedema? So internationally, lymphedema is defined as having 4 stages from 0, 1, 2, and 3. And stage 0 is a term that's used as a subclinical or latent potential. So there may not be visible signs of swelling in the tissue yet, but there may be compromises in the lymph transport capacity that's only detectable by imaging at that point. So anybody who's had lymph nodes removed or injured or damaged in some way would be considered at risk for developing lymphedema. And this can explain why sometimes people don't experience the onset of swelling until much later, many years later, because the system, there were only minor changes that the body was able to compensate with. In the very early stage, stage 0, when it's starting to shift towards actual visible symptoms, a patient may experience initial sensations of heaviness or achiness, burning or fatigue. And there has been research done on this now to show that it does correlate with people going on to develop lymphedema. So it's really important that if you have concerns, that you have it checked out. Stage 1, often there is no visible swelling. The patient can see that there's a difference in the tissue. It may not be so gross that it changes the contour of the limb yet, but it is visible at least in some part of the limb or the body. And this will often still respond to elevation. There may be some marks in the skin if you press on it. This is known as pitting. And typically the skin is still considered a normal thickness. As it progresses into the second stage, now we see more skin changes. There may be tissue hardening and fatty deposition as well. There may or may not be pitting depending on how much change there is, and elevation may not have as much benefit. And in stage 3, the swelling is considered quite gross. There's a lot of limb shape distortion and fibrous hardening of the tissues. And we want to, certainly gets more challenging to manage as each stage progresses. So regardless of whether we are at risk or we have active swelling, there are a number of precautions that we read about in the literature. And if we distill it down into 2 basic goals, the body is either we're trying to help the body maintain fluid balance, how much fluid is going into the tissue and how much is leaving that area that is potentially at risk, or if it already has swelling. And we want to reduce any injury or inflammation or infection to that region. So in terms of skin care, we want to take care of any cuts, scrapes, breaks in the skin and cleanse them, keep them covered for a few days, try and avoid insect bites if possible, because this can cause a local inflammation, make the swelling worse. We want to moisturize the skin to maintain that barrier. It's our first line of defense. With skin or with nail care, making sure we don't cut the edges of the nails, using a nail file if possible, using pushing the cuticles back rather than cutting them. Exercise, stretching, and maintaining a healthy BMI are also related to managing lymphedema and reducing symptoms. Avoiding blood pressure cuff, needle draws on the limb that is at risk, and avoiding tight clothing because this cuts off important lymphatic pathways in the skin for that fluid to be removed. Wearing protective clothing. So whenever we are gardening, hiking, using the oven, we're just adding an extra measure of protection to prevent injury to the skin. Avoiding extremes of temperature. So most commonly this refers to extremes of hotter temperatures, because the body is going to try and cool itself down. So it's going to send the circulation to the skin. And in the area where we have either decreased drainage or potential decreased drainage, it's going to make that swelling worse. So people often ask, well, you know, if my arm is at risk and I only put my legs in the hot tub, is that okay? And it may be okay for your situation, but it's not generally recommended because again, the whole body temperature is going to increase. It's going to try and cool itself down by sending the circulation to all of the skin. It doesn't selectively just send it to the area that doesn't have swelling in it. On the other end of the spectrum, extreme cold for prolonged time can also cause exacerbation of swelling. Initially, the blood vessels constrict, but after a period of time, they do start to expand again and the body will experience more swelling. Managing blood pressure is an important piece of managing lymphedema. So as our heart pumps out more fluid into the tissues, if there's a lot of extra circulation under high pressure, that's going to make more work for the lymphatic system to have to drain that fluid away. So managing blood pressure through lifestyle and medication if needed with your GP. And then wearing compression helps to stop that tissue from filling and helps to force more fluid back into the deep venous system and the superficial lymphatic system. So it helps to keep that tissue healthier. And this is especially important when we fly, when we can eventually do that again after COVID, because reduced cabin pressure allows tissues to expand. There's a less what we call tissue pressure, and the circulation leaks into the tissue more when we're flying, and we're more prone to swelling then. So I wanted to talk quickly about infection because that's part of the reasons why we take those precautions is to reduce the risk of infection. because each time we have an infectious episode, it causes more compromise in the system. And it isn't always evident whether if there is a skin break. Sometimes it can appear for no apparent reason. And people who have infection are more likely to have subsequent infection. So we really want to manage the swelling as well as we can. Infections can look different depending on which level of the skin they occur at. But the main thing is that you seek medical attention as soon as possible. Infection is most commonly associated with later stage lymphedema, but that isn't always the case. And in some cases, it can actually trigger the swelling in a latent situation. So I just put a little bit of information in about what infection might look like. Generally, it tends to look bright red. In this instance, it presents as a rash, but it might present as blotches or a streak up the limb. It tends to spread quickly, and it can be helpful to take a photo to document that if you needed to consult with your physician. And often there is a rapid fever, a very high fever, and people will have flu-like symptoms too. The skin may or may not be warm or hot to the touch. There may be itchy. Often the skin is harder because there's so much extra sweating and swelling, and often the swelling comes on quite suddenly. And there may be extra tenderness as well. So what are some of the goals of lymphedema management? Essentially to identify that it is present and provide education and resources that patients can feel empowered to live active and full lives. Conservative management involves exercise, compression therapy, skincare, and a specialized massage technique known as manual lymphatic drainage. The stage of swelling will determine which things would be appropriate for your situation, but at all levels, exercise, compression, and skincare are the basic tenets of managing the swelling and not having it progress or slowing the changes in the tissues. We want to reduce or maintain the volume of the tissues, keep the tissues soft, slow the changes of fibrotic changes, and reduce the infection risk. And something that we can do at home are take baseline measurements so that we have a benchmark, or do that with your care provider so that you can compare it every 3 or 6 months to monitor, has there been any change in that tissue. In some cases of secondary lymphedema following cancer treatment, we want to reduce the risk for potential symptoms by promoting functional scar tissue and the potential regrowth of lymphatic vessels through scar tissue. And finally, unfortunately, some people still experience disease progression in spite of doing everything that they know to do, and they suspect there may be a genetic predisposition for some people toward lymphedema. What is combined decongestive therapy? So it generally is considered to have 4 parts to it: manual lymphatic drainage massage, the compression therapy, so either bandaging for the intensive phase or compression garments for the maintenance phase. And exercise is important in managing lymphedema, and skincare, taking care of the skin. So what is manual lymphatic drainage? So it is this specialized massage technique. The pressure is very light because of the delicate vessels that we're working on. They start in the skin. And the first part of our lymphatic system is reliant on a passive filling mechanism and the alternating tissue pressure that's generated by the as we breathe, basically. So the difference between the chest and the abdominal cavity, as it alternates, it creates this alternating tissue pressure, which helps to fill these lymphatic vessels. So consequently, when we do the massage, we also need to do it slowly with a light pressure, and it has this sort of pumping mechanism to it. And this helps to fill the initial lymphatics that start in the skin. As the vessels drain into the deeper lymph collectors, they have smooth muscle around them and the ability to self-contract. So we can have an impact on both the superficial and the deeper system just by working on the skin. And the primary goal of the lymphatic massage is to redirect the fluid from an area of congestion to one that still has functioning lymph nodes in it. So if I had a right mastectomy, I could redirect that fluid across to the left armpit, or I could take it down to the groin on the right-hand side. If I had a right pelvic surgery and the nodes were affected in that region, then I could redirect it up to the armpit on the right-hand side or across to the left-hand inguinal region. So when we are considering management strategies, it really depends on stage of swelling. If there are just mild symptoms, it may be enough that exercise, elevation, doing some self-lymphatic massage and wearing ready-made compression is enough to manage those symptoms. But I would, if it's possible, please get at least one session with a lymphatic therapist so you know what level of pressure to use in the massage. Otherwise, you may not be benefiting from doing that yourself. If there are restricted scars or decreased range of motion, numbness, etc., then we want to try and address scar, do gentle scar release therapy in addition to the manual lymph drainage. We would always do that kind of work first before we do the manual lymph drainage. If there is significant volume or hardness in the tissue, then in addition to the lymphatic drainage, we need to apply the decongestant bandaging to reduce the lymph volume, help soften the tissues, and then the patient would get fitted for compression garments. It's important when we're working with an interrupted lymphatic system that you work with a therapist who has the advanced training so that they know whether it's safe to treat you and where to redirect that fluid so you're getting the most benefit out of that treatment. And then skincare and exercise are important at all stages, whether you're at risk or if you already have active symptoms. So exercise therapy or considerations, I strongly recommend that you seek guidance to do this safely based on your personal situation. But some of the basic premises are that we begin slowly, gradually increasing the challenge, increasing range of movement before we add resistance, and then gradually adding strengthening and resistance. Lots of research shows that strengthening program for 3 times a week really has so many health benefits. And it's important to take it in small steps. And I try to encourage patients to take the long view and think of it as a 6-month project of gradually improving their flexibility, their movement, whatever that means for your situation. Being sedentary is the worst thing because it just compounds the fluid staying trapped in those tissues. When we activate the muscle pump, it helps to move that fluid and keep the tissue soft. So even if movement is hard for you, trying to find ways to make movement a part of your daily routine. One of the cautions that we often read about in the literature with lymphedema is being careful with repetitive activities. And this is especially so when the limb is not prepared because it's not prepared for the elevated contraction. It can create inflammation in those tissues, and that can contribute to more swelling. The same applies to lifting heavy items. They can either repetitive movements or lifting heavy items can trigger a delayed onset of lymphedema even years later. But it also has been shown that when we prepare the limb gradually, slowly, and progressively, there are movements that we can do safely. So this applies to weightlifting and various other forms of exercise that might be considered repetitive. If it's done safely, monitored for any changes in the limbs, then that builds resiliency into those tissues. So I like to say when we contract muscles quickly or we put them on load or we ask them to do work for us, that increases the circulation in the tissues and the lymphatic load. So there's benefit to strengthening tissues, but whenever we have a decreased drainage from the tissue, then we need to help the muscle get rid of that fluid. And we can do that by contracting the muscle slowly and for a longer period of time. So warming up before exercise is very important, but it's especially important to spend 10 or 15 minutes afterwards to give your lymphatic system time to catch up to that extra circulation that's been put out into the tissues. And then finally, exercise is really a key in helping to remodel scar tissue and to keep the gel soft within our connective tissue, and it helps promote nutrients in and out of those cells. So the lymphatic system is housed within the architecture of our connective tissue, or this body sponge. The technical word is fascia. And if we have, think of it as having two components, the fibrous component and the ground substance, or the jello component. So if you were to insert a fork into a plate of cooked spaghetti that's just freshly out of the pot, you can twirl your fork around and it will, you can see those fibers slide and glide past one another. But if you were to leave the spaghetti and the jello to set, and now you try to move it, it's very difficult. So you can imagine it's difficult for nutrients to get in and out of that tissue. It's hard for the body to get rid of that congestion in the tissue. And it's also very hard for the body to regrow new lymphatic vessels through that scar tissue. So in general, this ground substance has the property of plasticine. If we leave it and it sits and it gets hard, it's very difficult for the body to use nutrients. But if we keep small amounts of energy and keep it moving, then the body is able to better exchange nutrients in and out of that region. So lymph nodes, once they have been removed, so sometimes they are removed for a variety of reasons, but especially in cancer treatment, the lymph nodes do not regrow, but the lymph vessels, they can regrow given the right environment. So if the connective tissue is elastic and mobile and pliable, there's more chance that those vessels will be able to regrow through that area. The lymph vessels have to be able to detect fluid within them in order to trigger that new vessel regrowth. So exercise and lymphedema, we want to keep in mind that a swollen limb will fatigue more easily. It's more susceptible to injury, takes longer to recover. We want to monitor for any changes in the limb and modify the exercise if we have any flaring symptoms. Being in the pool or body of water is like wearing full body compression, because the force of the water itself also helps to squeeze the tissue, so it helps reduce the fluid in the tissues. And if we have swelling or we're at high risk of swelling, then it's recommended to wear compression garments during the exercise. If you have active swelling, you should wear it for the rest of the day also. You don't need to wear compression when you're in the water, because the water acts like the compression. So compression is used both for those who are at risk and for the management of lymphedema. You do need to have a prescription from a physician, and you would take that to either a medical supply store or a certified medical garment fitter, who will help determine what the correct class and fabric for that stage of swelling is. And the compression, you gradually build up your wearing time for the compression. The goal is to wear it during your waking hours and launder it nightly, replacing it every 6 months, because if the elastic ages, it can allow the swelling to grow. We want to get remeasured at least once a year, preferably twice, to monitor for any limb changes. And keep in mind that weight gain or loss will affect how your garment fits, causing the garment either to feel too tight or to allow it to slip down. Keeping in mind that ill-fitting compression can make the swelling worse, so please make sure you follow up with your fitter to find the best solution for your situation. Night compression is indicated typically if there is pitting in the tissue, or if there's skin thickening or tissue fibrosis. And you can consult with your primary care provider whether it would be indicated for your situation. Again, the goal is to either improve the tissue or to delay the progression of symptoms. Day garments are not designed to be used at night because the pressure is too high for the pressure that we experience when we lay down, or our resting blood pressure. So if night garments are indicated, please make sure you get the appropriate kind. For some people who experience breast or truncal edema, these can be hard to compress areas, but wearing a snug fitting compression shirt and or padding either during the day or at night can help manage swelling in that region. So in terms of pharmacare coverage in BC, there is only potential coverage for arm or hand swelling after mastectomy or lumpectomy. Patients have to be registered with Fair Pharmacare. It's based on family income from 2 years ago, and there may or may not be a deductible based on that income. So I've included the information, the phone number and website here. Unfortunately, in BC, there is no swelling or no coverage for leg swelling, regardless of the cause of that swelling at this point in BC. Pharmacare coverage, potentially, if it's after a mastectomy or lumpectomy, the patient may be able to access 2 sleeves per year. There's no cost limit to the sleeves. It can be either ready-made or custom. In terms of either the glove or gauntlet, if that is required, then there's a maximum $300 for custom glove or gauntlet, or $150 for a ready-made one. So some of the key points for lymphedema: anyone who's had nodes removed or damaged is at risk of developing lymphedema. It's considered a chronic disease with no known cure presently. Onset may be sudden or gradual, even many years after injury. It's not your fault if you develop lymphedema, and there are resources to help you manage it. Regardless of the cause, whether it's primary or secondary, conservative management is the same. Either a combination of a manual lymphatic massage, the compression therapy, exercise, and skincare. And the level of intervention will depend on the stage of swelling. Initial sensations might include heaviness or achiness or fatigue in the affected body part before visible signs are evident. So if you were to imagine you had to carry around an extra liter of water in your limb or your body, that gets pretty heavy to have to do that. So the sense of heaviness is often one of the first sensations that patients report. Being your own self-advocate is really key to access care and management strategies and help monitor for any changes in the affected body part. Lymphedema does carry a higher risk of infection, and the limb tends to fatigue more quickly and take longer to recover if it's injured. We want to reduce the infection risk as much as possible by following the precautions and maintaining our skin care. That's our first line of defense. And finally, I want to acknowledge that coping with lymphedema can be very overwhelming, and I would encourage patients to find support and explore the strategies that work best for your particular situation. Most importantly, moving daily and stretching is really key to facilitating that muscle pump action, to keeping the fluid moving, and to keeping the gel soft so that it doesn't impede flow. So finally, I just wanted to say, if we can gradually insert little snacks of exercise through our day, whether mobility, no matter how challenging mobility is, if we can add some movement and view exercise as an ally, not a chore, then that is going to help with the keeping the tissues in a more optimal state. And that's all I wanted to say at this point. And I will open it up to questions.
So thank you so much, Carol. There were a couple questions that I'll start with in the chat. So the first one was, what does it mean to promote functional scar tissue?
So if we think about the, when I gave the analogy of the spaghetti and the jello, let's say you have a surgical site that has, the body tries to repair itself. It's a normal process. The body produces scar tissue. If we don't move it, it doesn't respond. Basically, scar tissue will respond to the lines of stress that we place on it. And if we don't ask it to move, then it just ends up looking like a lump of cooked spaghetti. So we can influence it by movement, by stretching, by self-massage, by lymphatic massage. All of those things can be helpful in creating that functional scar tissue. And with that, if we have that pliable scar tissue, then it also encourages the body to send out, the body's always sending out new chemical messengers when it wants to rebuild new lymph vessels or blood vessels in it. And if it sends out the chemical messengers and the scar tissue is too dense, it turns off that chemical messaging and the new lymph vessels don't regrow through that region. So it's really key to have movement be a part of recovery.
Thank you. The next question was, does using your bathtub work to do some exercises?
So that's a little bit challenging because we mostly like to take warm baths or hot baths, and hot baths are not, they're often, it's a relative cautionary practice, I guess, is the best way I can state it, because patients have to decide what is appropriate for them at their situation. And so if a person did not have a lot of swelling, maybe a bathtub doing exercise would be helpful in the bathtub. If they have arthritic joints, for example, then that might feel easier to generate some movement. But we want to be mindful that after using the bathtub, we need to still consider it as being a form of exercise, in the sense that it has increased circulation to all of the skin. And if you already have active swelling in a body part that is not getting rid of that fluid, then you want to engage the muscle pump to help get rid of that extra fluid after being in the bathtub, so that the tissue doesn't stay sort of boggy with the excess fluid in there.
Good tip. There's another question that just came in. What impact does stress have on the lymphatic system, and would meditation or mindfulness help?
So I am not a physician. I can give you my understanding of the impacts of cortisol. So stress creates different inflammatory agents in the body, including cortisol, which will make blood vessels more leaky. And so that could increase circulation in the tissues. And anything that helps us manage our stress could certainly potentially help with, reducing the amount of lymph load on the system to begin with.
Great. There's no more questions in the chat, so I can open it up quickly. I'll just ask everybody to unmute if you have a question.
Yeah, well, I just wanted to comment. It's not a question, but I wanted to comment that was an amazing amount of information you squeezed in there, Carol, and I love the illustrations. They were really brilliant to get some concrete idea of the concept. So thank you for that. And to let people know that, in actual fact, one of the other presenters that will follow your presentation is going to do a much more focused session on different kinds of exercise specifically related to lymphedema. So that makes a very nice complement to what you have presented here. That's Anna Demena will follow up. So we're going to present them in such a way that we recommend that people see the webinars in a certain order. And I think yours needs to be number one.
Okay. So Another question that I got from a patient, I didn't put them all in because I wasn't sure how much time it would actually take. And it had to do with what should I expect at my first MLD appointment? And I'll just speak to that quickly. Now, it may vary a little bit between therapists, but overall, you would want to have a comprehensive health history discussion around, essentially, is it safe for you to receive manual lymph drainage for the particular situation? Are there any contraindications that might not mean that you would benefit from treatment? We want to explain the goals of manual lymph drainage, combined decongestive therapy if that is required at this stage of swelling for you, and a basic introduction about the education around lymphedema. The patient needs to have opportunity to ask questions and to give consent to treatment. And certainly I like to take baseline measurements so that I know I have a starting point that I can compare that information going forward. And you know, noting time of day and body weight, because if we measure at you know, 3 months from now and you have lost 15 pounds and it's 10 o'clock in the morning versus 3 o'clock in the afternoon, obviously there will be more swelling generally later in the day, and the body weight will have an impact on the swelling. So I like to take both limb measurements so that we can put any changes in perspective. And then the therapist is going to assign or assess for any signs of changes in the tissue. Is the skin thickness normal? Is there any subcutaneous changes in the tissue? Is there any hardness? Is there any fatty deposition? Noting those signs, and then if there are, what the appropriate level of intervention would be for you at that particular point in time. Whether that includes, you know, self-instruction on lymphatic massage, how frequently you need to get it with a therapist, if you need to wear compression or not. And with the manual treatment, we always start at the neck because that's like clearing the leaves out of the drain before we ask it to take more fluid. And then we would prime the areas that need to be we're going to redirect the fluid to. So if it was the right armpit that was affected in the right arm, then I would work on the neck first, then work on the left armpit, prime that area and the left part of the chest before I would redirect the fluid across from the right-hand side. Prep all that before we even consider working on the arm itself, because the fluid has to have somewhere to go in order for it to be an effective treatment. And I think that's all I wanted to say about that. Does anybody have any questions?
Looks like there was one more that came in. Is it normal after MLD to have poor balance?
So because that could be an individual situation, and the body is returning that fluid back into general circulation. So some people need to urinate right away to get rid of it. It's a strong reflex. Other people, it takes longer for their body to detoxify that fluid, and they might get headaches or tiredness, or it might affect balance. So trying to drink fluids, I know it seems counterintuitive, but the more fluid you drink, the more it helps to flush that out of your system after you've had a treatment.
Great. And another, can MLD not work for certain patients? The person that said this question said they were recommended to not try from her specialist as it would not give any benefits.
So again, it depends on the stage of lymphedema. If it's there are a lot of caveats to this. So if a person had advanced swelling with lots of fibrotic changes, they really need to have the decongestive bandaging in addition to the lymph drainage massage, because you're not going to see a significant benefit just by doing the treatment alone. You might get some temporary relief, but it's not going to significantly change that tissue. You need to support it afterwards with either decongestive bandaging or compression. So for some people, it may not be the most beneficial. And it, you know, sometimes you have to just try things and see if it works for your system. Also, if there's a lot of scar tissue, the scar tissue may need to be addressed first gently before we then do the lymphatic massage afterward. And so for some patients who are recovering after surgery, it may be necessary to split the treatment, do a little bit of gentle scar work to help mobilize that tissue so that we can then encourage more fluid through that region and drain and promote the elastic scar tissue. Because again, the less dense that connective tissue it is, the easier it is for new vessels to regrow through that region.
Okay.
Great. And Carol, you talked a lot about skincare as well. Any tips or recommendations on kind of what great skincare regimen looks like?
I think most of us don't tend to think too much about skin unless it's a problem when it becomes drier weather, or so you know, really trying to keep it intact as much as possible. And that can be challenging if people also have contact dermatitis or eczema in addition to having lymphedema. So principles again of cleansing, moisturizing, you know, taking care of any cuts, scrapes, breaks in the skin. And often water-based moisturizers are recommended over oil-based, but again, you know, it's such a complex topic on its own. Wound care nurses are very well qualified to give answers to that. And people often have their own preference for lotion or cream that they like to use.
Great. And one more question just came in. Are there any tips that you would have around dry brushing?
So the principles for dry brushing are similar to lymphatic massage. If you have an interrupted system, you need to know where to redirect that fluid. So don't just, if you need to make sure that you're using the same protocol, redirecting away from the congested drainage area into one that is functioning. And St. Margaret's Hospital in Ontario, the University Health Network, has a good link. If you just search their website, University Health Network St. Margaret's has video and PDF for self-lymphatic massage that you can also apply to skin brushing. And it's lymphatic therapists who are presenting that information.
Great. Well,
I had
think,
another, sorry.
Oh, go ahead. Yeah, no, because that's it on our side. There's no more questions in the chat.
So some of the other questions that I got was compression. Do I really need to wear it every day? And so many questions have, well, it depends. And this depends on whether a person is at risk or if you have active symptoms and the stage of swelling. So if a person is high risk to develop lymphedema, then use of compression, at least for exercise and prophylactically during the day, may delay and help promote that functioning scar tissue. If a person has active swelling, then you really need to wear the compression to preserve the function as long as possible and to slow the progressive changes that can happen in the skin. And ultimately, if a person ends up in a stage 2 or more lymphedema, it's really not a choice not to wear compression because the symptoms are so significant that the compression offers support to those tissues in a very noticeable way. And then the other part to that question was, how long can I wear the compression before I have to replace it? So generally, it's recommended that you replace it every 6 months because the fibers do age and get stretched out, and that can allow the swelling to grow. And then people might start to have more symptoms again of either the achiness or the heaviness, or they put the compression on, but it's just not seeming to give them any relief. And the more advanced stage, the compression may need to be replaced every 4 months instead of every 6 months. you know, each person's situation is different. But if the compression isn't working well, please go back to your fitter and sort it out, because that is really key to long-term management and, you know, giving the patient independence and autonomy over their day as well, like things that you can, so you're able to manage the swelling as much as possible on your own. I'm reaching out for resources when you need to for the lymphatic massage, or you know, if you need to have another intensive phase to do decongestive to get the tissue softer again and the volume reduced. Okay, so that was all the questions I had for now. If anybody has any other questions, otherwise we're coming up on 5 o'clock.
All right, no more questions, it sounds like. So thank you so much. We really appreciate your time, Carol, and
You're
all your
welcome.
insight. That was a lot of information. So glad it's recorded, because I'm sure a lot of people will want to go back and refer to it. So thank you very
Okay.
much.
Great. Thank you very much, everybody, and enjoy your evening.
Take care.
Okay, bye-bye.